Let's talk about how to fix chronic back pain. Actually fix it. This is going to be a no BS, no frills, no fluff video of the actual steps that you need to take if you really want to break out of chronic back pain for good. If you don't know who I am, my name is Dr. Nate. I'm a licensed doctor of physical therapy with a background in neuroscience and a personal 4-year battle with chronic back pain that I was able to overcome. And now I help other people do the same. All right, so first of all, what are we talking about when we say chronic back pain? So the key distinction here with chronic back pain is that this is a long-term problem. So this is not something that just started last week or a month ago. What we're talking about with chronic or persistent back pain is pain that comes on and then persists for months, years, or even decades for some people. So in most cases, it's been more than 6 months, usually more than a year, and it's been this recurring cycle. So maybe you get better for a little bit and then it comes back. And it's always sort of this up and down nagging pain that just won't go away. And this type of long-term cyclical pain plays by much different rules than what we usually think of as acute pain. So acute pain is when you go out and roll your ankle, or maybe you get your back injury for the first time. Let's say you're doing a deadlift in the gym, you do too much weight on the bar, you pull it too quickly, and boom, you get some kind of pop in your back. That's more of an acute presentation when the pain first comes on, and it's usually triggered by something physical or mechanical. So a lot of chronic pain will start like this. It'll start as an acute injury where you do something physically to cause immediate tissue damage to a certain part of you. And the pain you get in that moment is pretty much a direct correlation to the injury or the damage that's happening right then. Chronic pain is a little bit different because it doesn't always present with the same amount of physical injury or damage as an acute injury. And that's really one of the first most crucial steps in overcoming chronic pain, is just understanding this distinction about what makes long-term persistent pain different than acute pain. Because again, acute pain is very one-to-one with physical injury or damage. If you fall off a bike and you break your arm, that pain that you're getting acutely in that moment is pretty much one-to-one correlated with the injury or damage that you sustain. Or if you're playing basketball and you roll your ankle, that pain is an indication that you just injured yourself, you just hurt yourself physically. But the really crucial thing to understand about long-term persistent pain is that this relationship between physical damage and pain isn't usually present in these long-term situations. Meaning when you go to tie your shoes and you get an increase in pain, or you're doing the laundry and you're bending over and you get an increase in pain, or you wake up in the morning and you're more stiff and uncomfortable. These scenarios where you have an increase in pain or stiffness or discomfort with a specific movement or just nagging at baseline are almost never an indication of active further injury or tissue damage in these long-term chronic presentations, meaning that you usually aren't causing more harm or physical injury to your spine or your back when you're having an increase in pain, even though that's sort of how your body is presenting it to you. So that is really the first step or the foundation to overcoming chronic back pain, is sort of reframing your understanding of what the pain actually is. Because if you always have the assumption that pain equals damage, and every time you move or you get an increase in symptoms that you're causing further damage to your spine or you're making things worse, it's going to be really hard for you to move forward and move past that, because your body is always going to be stuck in this sort of fight or flight stage. Your nervous system plays a massive role in this process, especially if the pain started with an acute injury like a disc herniation or a pulled muscle or something traumatic that set things off. Because your body is going to naturally adapt to that pain and start compensating in certain ways. And one of the biggest compensations it'll make is to start lowering your pain threshold. So maybe before your injury, your threshold for pain within your back was up here. But because your body learned that bending forward was harmful or dangerous, your nervous system can adapt to that and start to lower its sensitivity settings for what it's classifying as harmful or potentially dangerous, which means that you start getting pain and symptoms at a lower and lower threshold of movement or activity. A lot of times to the point where you just have baseline day-to-day nagging tightness and symptoms, because everything is crossing that threshold. So understanding this concept is absolutely vital to this process, because essentially what we have to do with chronic long-term back pain is retrain your body and your nervous system to better distinguish distinguish between what is actual pain and what should be pain, and what should be felt as just normal sensation that your body should likely just ignore. Your body has billions of tiny little sensors all over you, and they're constantly picking up sensation and sending information into your central nervous system for it to interpret. And the vast majority of these sensations or data points are completely ignored. Think about it. Right now, you're probably not thinking about the sensation in your left elbow or in your right pinky toe. And that's because your nervous system has no reason to interpret the sensation there as harmful or dangerous or something that it needs to warn you about. But with your back or with any injury or pain that you've sustained for a long period of time, that's not the case. Your body has actually gone the other way, where it starts to oversensitize those regions and those parts of you that have been in pain for a long period of time. So that is really a huge part of this process, is we first have to recognize that this is actually a thing, that your body and your nervous system adapt to pain and symptoms over time, and that the pain you're getting with long-term chronic pain is very unlikely to be correlated one-to-one with physical tissue damage. So once we understand that concept and we can sort of grasp that consciously, the next step is to get the rest of your body and nervous system to understand that unconsciously. So that's what I usually refer to as the rewiring part of this process. Your body has gone through thousands or tens of thousands or hundreds of thousands of repetitions of reinforcing this sensitivity. So we have to work to reinforce it in the positive direction. Okay, so how do we do this? One of the ways we can do this is through movement and activity. Now, this is where most people go wrong in their rehab approach. And to no fault of their own, this is the typical approach that you'll get from social media and even from a lot of healthcare providers like physical therapists. You'll get a bunch of random exercises that are supposed to be correcting very specific biomechanical issues, like saying that your core is weak and you need to work on these very specific stabilizer muscles, or your glutes are weak or they're not firing and you need to work on bridges to get those going, or your psoas is tight or your hip flexors and you just need to stretch these things out. And sure, some of those things might help, especially if you're in a more acute phase and the pain is probably just going away on its own pretty soon. Or they might just get you moving a little bit more and helping you ease back into movement, which is totally fine. But instead of trying to surgically diagnose which exact muscle is weak or tight or what we need more stability in, I think a much better approach for long-term chronic back pain is just to make a list of all the things that you do get pain with. It might be bending forward, picking stuff up, squatting, twisting, running, but there's probably a whole big list of things that you can come up with that your body gets pain and symptoms with. Okay, so you have this list of all the things that give you pain, or the things that you're not even attempting to do right now because you have pain. And the key to really moving forward in this and breaking out of this cycle for good and actually making some progress is, again, not to get surgically honed in or hyperfixated on specific pieces of anatomy or muscle groups. Instead, what we want to do is take that huge list of things that you get pain with, or you're struggling with, or things that you aren't doing right now, and to come up with small versions of all of those activities that you could start today that wouldn't increase your pain. So if you get pain with bending forward, for example, just tying your shoes or picking something up off the floor, your first step to overcoming that shouldn't be something big or extreme like Jefferson curls or jumping on the back extension machine or deadlifts or picking up something heavy. It should be something so small that your body and nervous system don't even classify it as something potentially dangerous. Because again, what you're getting here is a mismatch between the activity you're doing and the pain that you get from it. So what we have to do to rewire this sensation is to start way below your current threshold at a place where your nervous system is completely comfortable. So for bending forward, this might start with just a few degrees of flexion, maybe in a seated position. So you just practice giving your body small, manageable reps of something that you have a pretty good likelihood of succeeding with and not setting off your pain with. So again, the key is to start small and start sub-pain, start below your threshold. The same thing applies if you're trying to get back into an activity like running. You might be used to running 5Ks or half marathons or full marathons. So something small like a 1 or 2 mile run seems like it should be pretty easy, even though it gives you a ton of pain. So again, the key to something like this is to start way below that threshold. So you might not start with a 1 mile run. Your starting point might be 10 minutes of normal walking pace weaved in with 5-second slow jogging intervals. Again, something really manageable that your body is likely to succeed with without having a flare-up or setting off the pain alarms. That's the key to this. But the most important thing here is the entry point. It's finding that first small step that you can take that you know with almost 100% confidence is not going to set off your nervous system to think that you're doing some kind of dangerous or harmful activity. And then the trick is once you have consecutive days or sessions where you do this small step over and over without an increase in pain while you're doing it or the day after or 2 days after, once you have multiple of these days in a row and you have confirmation that that's a good starting point, the trick is then to scale it up very slowly, just 5 or 10% at a time. So not trying to make too big of a jump at one time, but taking small, manageable, and progressive steps. And you can do this with pretty much any activity that you want to get back to or any activity that you are currently having pain with. And you can also do this process with the major movements of your back to really increase the overall strength, tolerance, and resilience that you have. Because all the movements that you do with your back throughout life on a day-to-day basis can basically be broken up into 4 major categories. You can bend your back forward, that's called flexion. You can bend your back backwards, that's called extension. You can bend side to side, and you can twist left to right. So those are the 4 major movements, and then there's a 5th one that I like to throw in, which is hip hinging. So hip hinging is that same movement of going forward, except you're keeping your lower back straight and tight and hinging at your hips instead. But instead of having some really complicated system where you're trying to diagnose specific body parts and muscles that we don't actually have good evidence for as being a main cause or contributor to back pain, instead of getting all hyperfixated on that stuff, I think a much better approach for most people is just to take these 5 major movements and progressively overload them. Meaning that you start with something that is simple and easy and can start the desensitization process, but that you can scale up slowly and predictably over time as your symptoms improve and as you gain more strength and confidence in your back. So again, going back to our example of forward flexing, your starting point might be just a few degrees of flexion back and forth in a seated position. But over time, you can start to increase your range of motion slowly and steadily as your nervous system starts to become desensitized to that position and that movement. So eventually you might get to the point where you feel comfortable going into full flexion and full extension within a seated position. And then from there, you might think about trying this in a standing position. So you can do the same process, just start with whatever is comfortable. Maybe that's halfway up and down your thigh. Maybe that's down to your knees eventually, maybe halfway through your shin, and then eventually as far as you can go with it, without pain, without symptoms, and without that fear or hesitation with the movement. And then you can repeat that process with the other 4 movements that we talked about. But again, the key here is to start small and start at a level that might even be way easier than you think you can do. Because you probably have the strength and the ability to do those movements in their fullest form if you really wanted to. So it's not necessarily about the strength of the movement, it's the sensitivity of it. And to reset those sensitivity settings within your body and your nervous system, we have to start with the smallest possible version of that movement or activity that your body feels okay with and doesn't set off your pain. So I hope this video was helpful and can at least steer you in a better direction going forward. If you need more help with this process and you want a real step-by-step system that actually addresses everything we talked about here, I would invite you to check out what I do at BackUnbroken. BackUnbroken is built around all of these concepts, around reframing your perception and idea of pain on a conscious and unconscious level, rewiring your pain reactions and how your nervous system is interpreting symptoms, and building up strength, resilience, and tolerance within your back so that you can handle anything you want to do in life. That's exactly what this program is built on, and it's helped hundreds and hundreds of people overcome chronic back pain. People that had tried everything and thought that they would never get out of pain. The program also starts with a free trial, so you can get in there and experience it for yourself and see if it's a good fit before you end up paying anything. So if you're interested in learning more, I'll leave a link down below so you can check out all the details. But otherwise, keep working at this, don't give up hope, and I'll see you in the next video.